Past outbreaks of Ebola have involved hundreds of people. This may involve hundreds of thousands or even more. What happened?
What happened is that Ebola collided with a broken down healthcare system, a system that really had never been built after conflict, after war and violence. The cases were known about in March. The epidemic was announced in March. And I happened to be in Sierra Leone in early June. It was quite clear then that this was going to plow into the city. They just have very weak, or they had very weak health systems, health delivery systems, and now unfortunately they've collapsed altogether. So to stop it, you have to do two things at once. You have to respond, to the emergency, the crisis, but also to link that to building back their system, or to building a really strong public health system that could go all the way from villages and communities to hospitals. That's a tall order.
By mid-June, it was already apparent that this was the biggest epidemic ever. Why did it take seemingly till 2 Americans got infected before the world really woke up to it?
It seems like some far off and exotic concern. You heard stories in the American press about bushmeat and other things that aren't familiar to us, and the claim has been made that people look different, they had different histories, had different cultures. All that is true. I think that seeing American humanitarians fall sick is a reminder that this is an illness, a zoonosis, that can leap from animals to humans, and we're all human. In my experience over the years, it's always more difficult for people to see themselves as the potential casualties until people start looking and sounding like they do.
In the past, it's been limited to rural areas. It seemed to burn out very quickly, and it got into the cities now.
It's in the cities, and it's in the healthcare institutions. One of the greatest ironies about Ebola is that it is a disease of caregivers, right? So you take care of someone who's sick, who's vomiting, who has diarrhea. Who does that? Well, sometimes if there's a near collision with modern medicine, it's nurses and doctors. It's usually your mother. And that's why 75% or so of all cases are among women. It's a disease of caregiving. So, there's a pathos there too, right? You want people to care, but they have to be protected from infection themselves. And that is not rocket science, right? We can figure out how to get personal protective equipment to people who are giving care.